Hello students, we will discuss again an important condition which we come across in surgical OP. What this condition is, okay, it's very common. It's a long case kept in the exam, like peripheral artery disease. Varicose vein also a long case kept for all UGs, even postgraduate is kept as a long case. So what this condition is, it is varicose vein of the leg. You can see very obvious, it dilated, tortuous, elongated veins, mainly great saphenous veins, some communicating veins are there. There are changes, skin changes here. There are skin changes here. Look at this, skin changes, dilated veins. It's a tortuous veins. You can see that. So varicose vein of the right leg, very typical. So what are the features? This definition is very important. Permanently dilated, elongated, tortuous, superficial veins. Now these meanings are important. Thread veins are less than 1 millimeter. Reticular veins are less than 3 millimeter. Small varicose vein is less than 4 millimeter. Large varicose vein is more than 4 millimeter. So definition of all these things, thread veins, reticular veins, small and large varicose vein. Now this classification is current classification used CEAP, clinical, etiological, anatomical, pathological. Accordingly you have to give a diagnosis. C how many are there, E how many are there, P how many are there, C 0 to 6 like that, P, E, anatomical. So you have to nomenclature. If you go through the book, my SRB manual surgery and clinical book, both it has given table. Accordingly, you have to give a diagnosis in all varicose vein cases. In the long case, you have to write what CEP classification in that particular patient is. That's important. The theories are fibrin cuff theory, white cell trapping theory, primary varicose vein, and secondary varicose vein after some reason, usually standing in thrombophlebitis. That is, primary is in familial one. Great saphenous vein varicosity, short saphenous vein varicosity, perforative varicosity, communicating. Remember, communicating veins are different. Perforative vein is from the superficial to the deep, directly perforating the deep fascia. Communicating veins may be from the great saphenous vein, from the posterior arch vein goes to the great saphenous vein posteriorly, or from one short saphenous to great saphenous vein, like that. From the intercommunicating between the superficial veins. That is the meaning of communicating veins. There is a technical, anatomical meaning differences are there with all these things. So these are the anatomical classification which you have to remember. Of course, CEP is the standard. This is you have to remember. Most important. So how to manage? Doppler is very important. Venous Doppler. And different surgeries, laser therapy or radiofrequency ablation, Trendelenburg operation, perforate ligation, all those things are very important. Doppler is a must before surgery. DVT has to be ruled out to do anything. Telotherapy also very useful. So different procedures are there for varicose vein. So how to examine varicose vein is very important because it's a long case. Go through my clinical methods in surgery with the video lecture there, and my manual of surgery gives details about the venous diseases of different types, including in detail about the varicose veins. Of course, surgery for varicose vein gives in operative surgery very detailedly. Suturing technique, of course, my video lecture through visual lecture in DigiNerve through JP gives the entire varicose vein proper lectures, including DVT. So you can always go through that. So students, I hope you understood basic about the varicose vein. Thank you very much.